that 1 in 6 women struggle with infertility, and most women are unaware of it until it is too late. That's why it's important for us to be knowledgeable about the signs of infertility so that we can carry out appropriate steps beforehand so as to avoid running helter-skelter later in future, because some of these signs of infertility are present in our bodies right from the time of puberty. Yes, right from the time of puberty. That is why in this video, we're going to be discussing infertility, specifically in women. We're going to look at the signs associated with infertility in women, also look at the predisposing factors to coming down with infertility, as well as the treatment modalities that we have out there for infertility. So it therefore means that this video is not just important to those who are willing to have kids now, but those who want to have kids in the future. This video is important to you all. Having said that, I have left some timestamps in the description box below to help you navigate this video. Hi beautiful people, welcome back to the channel. If you're stopping for the first time, you're welcome. My name is Isolona and I am a registered nurse midwife as well as a professional makeup artist, and over here we discuss all things pertaining to faith, health, beauty as well as nursing. So if these are the kind of content you're looking out for, please do not hesitate to like, to share, as well as subscribe to the channel. Now, as a way of introduction, let us understand what infertility is. Infertility is simply the failure to achieve pregnancy after 12 months or more of unprotected sexual intercourse. And according to WHO, statistically speaking, about 17.5% of adults suffer from this challenge, and that means it's 1 in every 6 persons do experience or struggle with infertility in their life. Now let's look at the causes of infertility. Now remember that this video we're looking at infertility in women. Now the causes of infertility in women are usually linked to ovulatory problems, and what I mean by that is that things or factors that could affect the release of egg or the ova from the ovaries in the woman's body. Now, one factor that could be responsible or that could cause infertility in a woman is endometriosis. I've talked about this in a previous video. I'm going to leave the link in the description box below. But in endometriosis, what essentially happens is that the cells and the tissues that line the topmost layer of the womb or the uterus, where the fertilized egg is supposed to stay in or embed in, is now being wrongly placed. You have those cells in that region, and then you have it in other regions outside that region, that is outside the endometrial layer of the uterus or of the womb. Now you could find it in the ovaries, in the fallopian tube, as well as other parts of the body. This could go on to cause infertility in a woman. Another thing that could be responsible is polycystic ovarian syndrome, which I have also explained in the previous video. I will also leave the link in the description box below for better understanding. But here there's presence of a fluid-filled cyst in the ovaries. Remember, it is the ovaries that produces or releases what we call eggs, and these eggs are what is needed to be fertilized by the sperm for conception or pregnancy to occur. Now, anything that could cause problem to these ovaries could trigger infertility. Do you understand? Now, another point we have is scarring. Now, surgical interventions such as unsafe abortions could lead to damage. Yes, it could damage the fallopian tubes, it could damage the cervix, and in turn, it could lead to infertility. We also have fibroid. Now, fibroid are non-cancerous growth that are found in the body. Now, this non-cancerous growth, depending on its location in the womb, it could affect fertility, leading to infertility. For example, if this abnormal growth or non-cancerous growth is found in the fallopian tube, I'm going to insert a picture on the screen. If it is found in the fallopian tube, then it could prevent the egg from getting to meet with the sperm, or the sperm from getting to meet with the egg, and invariably prevent pregnancy from taking place. We also have drug use. Now, every single drug out there have side effects. That is why you will see that any drug you buy, there's always a side effect written on it that, okay, you could calm down with this. It could be headaches, whatever it is. Every drug has side effects. Now, the prolonged use of a certain drug could increases your chances of experiencing these side effects. Now, drugs such as the non-steroidal anti-inflammatory drugs or the NSAIDs have been linked to cause infertility when used for a long period of time. Also, women who are going through chemotherapy for treatment, that is, women who have cancer, who are going through chemotherapy for their treatment, they are also predisposed to coming down with infertility. So this could also cause infertility in such a woman. Now, apart from all these causes that I've explained, we also have thyroid problems. We could also have pelvic inflammatory disease. That is, these are diseases or infections that are located in the pelvic region of the woman's body. It could actually cause infertility. Also, cervical mucus problems could also result in infertility. Cervical mucus is expected to be thin for the sperm to reach the egg for fertilization, but a situation whereby it is actually very thick and is preventing the sperm from passing through, it could lead to infertility. Now, having said all that, let us go to the crux of this video, which is the signs of infertility in women. Now, the number one sign I want to talk about is irregular menstrual cycle or irregular menstrual flow. I said at the beginning of this video that there are certain signs of infertility that are present in the woman's body right from the time of puberty, and I was referring specifically to this, which is irregular menstrual cycle. Now, let me explain. Irregular menstrual cycle has certain characteristics that are associated to it. One characteristic is having a menstrual cycle that is 21 days or that's less than 21 days or more than 35 days apart. What do I mean by that? If you see your menstrual flow every 20 days or every 19 days or every 15 days, it is deemed irregular. If you see your menstrual flow every 38 days, every 40 days, every 42 days, it is deemed irregular. Why? Because it is beyond 21 days and 35 days time frame. Another sign could be missing your period 3 or more times in a row. Now, what do I mean by that? Take, for example, you saw your period in January, that you had a monthly flow in January. February, you didn't have it. March, you didn't have it. April, you didn't experience it. Then you went on to have your period in May. Now, that means February, March, April, 3 consecutive months, you skipped your period. That is deemed an irregular menstrual. Also, another sign is experiencing bleeding that is heavier or lighter than normal. Now, there are some of us who experience menstrual flow that is heavier than normal. That is, if we have a sanitary pad on now, an hour or two later, it is completely full. That is completely full. It is even leaking or seeping out blood. Then that is deemed an irregular flow. Because ideally, the sanitary pad is designed in such a way that it could hold the blood content up until about 8 hours. Now, if you are using it properly, correctly, and then it is getting filled 1 hour, 2 hours, then that could be as a result of infertility. It could be a sign of infertility. Also, if you are experiencing spotting, that is light bleeding, as opposed to normal bleeding, is just like you had a little cut on your finger, that kind of blood that you lose when you have a little cut, that is what you're experiencing. That could also indicate that that is a sign of infertility. Another sign could be having an interval between your menstrual cycle that exceeds or extends beyond 9 days. What do I mean by that? If you see your period this month, 28 days after your last period, that's after your last menstrual flow, 28 days later, you saw your period this month. Next month, you see your period 40 days after your current menstrual flow, is an example. That means that is an irregular menstrual flow, because you have, if you take away 28 from 40, you have 12 days interval between this and the next cycle. Do you understand? So that is deemed an irregular menstrual flow. Another sign could be if you are having a menstrual flow or bleeding that exceeds 7 days. You are bleeding continually for beyond 7 days. It could also indicate infertility. Also, if you're experiencing bleeding or spotting between periods. That is, normally when you see your period after the 5 days, 7 days, whatever interval you experience, you have a period of rest. That resting period is the time needed for the body to recuperate and prepare again for the next cycle. That is how the menstrual cycle goes, right? For the next flow, that is how the menstrual cycle goes. But if you experience your flow now, after the 5 days, then the time you are supposed to be resting, the time your body is not supposed to be experiencing bleeding, you are now still bleeding, whether it is light or it is heavy. And then you now go on to see your period proper later on. That is an irregular menstrual flow. Now, other signs include having painful menstrual flow, as well as experiencing pelvic pain during your menstrual flow. And I know a lot of persons experience this, especially the painful menstrual flow. Now, the major signs of infertility are obviously finding it difficult to get pregnant, and also if you're having recurrent miscarriage, that could also be a sign that you are battling infertility. Now that I've said all this, please assess yourself. Young woman, assess yourself, especially based off the characteristics of irregular menstrual flow that I've talked about, so that if you fall into this category, you can go to the hospital and get help, because the causes of some of the signs are due to health conditions that are treatable. So for me, I prefer you treat it now that you're young, now that you are just in puberty, now that you're adolescent. Don't wait until when you're ready to have kids before you start trying, and then you find it difficult and start treating. Treat it now, okay, to avoid running up and down later in future. Now let's look at the factors that predisposes us or puts us at risk of struggling or experiencing infertility. One is our age, and as a woman, is a very, very major factor, because fertility actually declines with age in women. So that is why once you're in your 30s, especially your mid-30s, you notice that fertility level drops. I'm not saying it's not possible to get pregnant, but it gets more difficult or challenging getting pregnant at that age, okay? Other factors could be alcohol consumption and smoking. Anything you're smoking, whether it's little cigarette, whether it's marijuana, it predisposes you to coming down with this. Also, family history. There are people who have infertility in their family, so check yourself. Okay, it could predispose you to coming down with it. If you're that kind of person that doesn't do exercise, if you're obese, that is, you're fat, you're obese. If you are underweight, you are not eating well or eating healthy, you're skinny, you're underweight, then you are predisposed to having this. Certain health conditions as well, health conditions like fibroids can predispose us to having infertility. Now let's look at the treatment modalities that are available for infertility in women. For women, the treatment modalities are usually centered around pharmacological treatment, assisted conception, as well as surgical intervention. Now, for the pharmacological treatment, medications are being given, that's drugs are being given, and the drugs are given to help ovulation. Okay, ovulation, I said, is the release of egg or ova from the ovaries. These eggs are important because that is what is being fertilized by the sperm, and then conception or pregnancy takes place. So the medications are given to help the woman's body produce or release eggs. Remember, I said that factors responsible for infertility usually hinder ovulation from taking place. Now, the drugs will help your body release eggs, not just eggs, but good eggs. Also, the drugs are also geared towards helping people with symptoms associated with conditions that are treatable. For example, women who have symptoms of PCOS that could be responsible for their infertility, you'll be given drugs to help you combat those symptoms, okay, because PCOS doesn't have cure. Combat the symptoms and also increase your chances of having kids. Now, for the surgical intervention is being done to identify what exactly is causing the problem, as well as proper solution to it. Now, for example, a woman who is experiencing infertility, and it was realized that the cause of her infertility is as a result of PCOS, that's polycystic ovarian syndrome. Surgical intervention can be carried out to get rid of the cyst. Remember, this condition is presence of a cyst in the ovary. So the surgical intervention can be done to get rid of the cyst. right? So that the woman could have her kids. Also, for example, women who have fibroid that is hindering their ability to conceive, then surgical interventions can be done to get rid of that abnormal growth in women. And finally, for the assisted conception, it could be in the form of artificial insemination, where the sperm is being taken from the man's body and artificially placed into the woman's womb or into the uterus so that it can easily meet with the egg for fertilization to take place. Now, this is done with the aid of a tube, so it is not your actual normal sexual intercourse way that you can do this. So it is being done with the aid of a tube to help just make it easier for the sperm and egg to meet and fertilization take place, and invariably, hopefully, conception takes place as well. Also, we have in vitro fertilization, where the woman's egg is taken out, the man's sperm is taken out and placed together in a kind of incubator for them to fertilize. Once fertilization has taken place, then the fertilized egg is now taken back into the woman's body for growth and development to take place like a normal baby would. So that could be another means. Also, donation of sperm if the challenge is with the man's sperm, as well as donation of eggs if the challenge is with the woman's egg in general. So these are the treatment modalities that are out there. See, one thing I always believe in is prevention is better than cure. There's no woman who want to get to the point where she's ready to have kids and then she's now struggling. She's now struggling to have kids. Please, please, please. This video, share it with someone because it could help someone in the future or help someone now. Check yourself. If you are experiencing any of these signs I've talked about, take the right steps. Take the right steps. Don't wait. Take the right steps now so that you do the right thing and you forget about it. So that when you want to have kids, you have your kids stress-free, okay? And with that, we've come to the end of this video. I hope I was able to educate us all, okay? And I hope we're able to get the message. If there's anything you don't understand, please let me know in the comment section below. I'm here for you, all right? And if there's any point you would love to add, let us know in the comment section below as well. Please do make your recommendations on the kind of contents that you would love to see in the comment section. And until I see you next time, bye, lovelies, and God bless you.